Good morning. I'm so delighted to be joining you today, even if it's just remotely. I'm particularly happy to be joining a group of such wonderful researchers focused on gathering evidence around the needs of young children and families. I want to send a special thank you to Dr. Ghassan, to Laura, Grace, Mohammed, and the entire team at the Arab Network for Early Childhood Development for inviting me to be here with you today. I want to tell you a little bit about what I'm going to talk about. I'm going to mention 4 overall topics. I want to reflect on our core child development principles. And although I know that's baseline and that we've all heard these things before, I always like to start with some of our core values. Secondly, I want to turn to the global challenges to healthy child development that young children are facing around the world, with a particular focus on climate change. Third, I want to at least mention 2 of the promising trends that I see globally in early childhood, and then end with some of the research, the innovation around research, and that underscores the importance of the work that you're about to do for the next 2 days. After each of those sections, I'll add 1 or 2 research questions for you to consider. So let me get started. I want to start with these developmental principles, which should guide our vision of early childhood and form the basis of practice, policy, and research. And I'll mention 3 of them. Let me start with what we know is the most basic level of principle of child development, and that is that it is one developmental period builds on another. That's why we have to start early, start in that prenatal period, and go through the early years of life. What happens in the early years affects health, learning, and behavior. We know that, but I think we have to reinforce the importance of thinking about the whole developmental continuum. Secondly, we've come to know and understand that the domains of development are integrated. That's why the Nurturing Care framework addresses multiple domains of development. We know that health affects education, nutrition affects health, and all of the other integration that is needed across the developmental domains. But I think we have to keep reinforcing that so people understand when we talk about coordination, why we're doing it. Otherwise, I think we'll miss an opportunity. Third, we talked for years about the ecological approach to child development, that the child is influenced by the family by the community, and the community by the broader policy context. We have to use those principles and remind people what that means. That means that the nurturing care that we're hoping that caregivers are able to provide is dependent on the well-being of the adults in the children's lives, which are also dependent on the larger community and policy environment. These things all go together, and it's important for us to keep reinforcing these very common principles of child development. So our work is to reduce the risk factors in a child's life and increase the protective factors so that we can see optimal child development. What's the implications of this for research? I would ask you to consider questions like this. Where are the gaps in research across the developmental continuum? Are we considering the interrelationship of impact across sectors? Are we looking at the enabling environment of caregiving when we're considering child outcomes? And what are the risk and protective factors in your particular cultural context? So these are just some of the questions that emerge when we consider developmental principles. Moving on to the second category of discussion, which is unfortunately the challenges to healthy child development, the risk factors. We've just lived through a very long period of COVID and a very long period, too long, of conflict, and we're facing climate change. All 3 of these risk factors lead to physical harm and loss, disruption and displacement, material hardship, which in turn leads to parental stress and undermines our ability to provide nurturing care. Just turning to COVID for a minute, we know that it's increased poverty and had a detrimental impact on families and on the developing child. We also know that conflict continues to have that serious impact. In 2018, before some of the conflicts that we're seeing now, more than 1 in 5 babies were born into a conflict or a crisis setting. In a research report that was released last December by the Forum on Young Children in Emergencies, which I'll talk more about later, they talked about the fact that of the more than 100 million displaced people around the world, we don't have exact numbers, but we know almost 12 million of them are children under age 5. 71 million children, according to the report, under 5 have lived in conflict areas their entire life. And the reasons, of course, are interrelated because we know conflict, health, and disasters often are interrelated in the same community. We've also talked a lot about in this report, and I know many of you are focusing your research on emergency context, that we have to start differentiating the kinds of emergencies, that there's a big difference between the issues that families are facing during the acute period in a crisis over time, or if you're living in a protracted crisis situation. So we have to start differentiating those things when we think about the risk factors that children are facing. On the good news side, I think we are seeing action, which helps us with our sense of agency. The early childhood community all around the world provided major support during COVID for families, from providing nutritious meals to making sure there were early opportunities, particularly through technology. The Moving Minds Alliance is an alliance that's emerged to put a focus on making sure that young children and families of young children in emergencies are getting attention. And then, of course, the Early Childhood Peace Consortium has been continuing to see early childhood as a mechanism towards peace. So this is the positive side of those 2 risk factors. If we turn to climate, and this is the cover of the pioneering work done by the Asia Pacific Regional Network on early childhood. They did a scoping study that was released in November, and they talked about young children as vulnerable, but they also talked about them as valuable to the future of sustainability. And I think this framing of both vulnerability and the value of early childhood has to be underscored in our framing and in our messaging. It's undeniable now that we're facing environmental challenges. This is from the International Panel on Climate Change from 21. And we know that the carbon emissions have been rising exponentially, and that's having a dramatic impact on the atmosphere, the ocean, and the lands. If you look at, this is from UNICEF. This is UNICEF's from the climate crisis is a child's right crisis. They introduced the Children's Climate Risk Index. If you look at the map, you see that the distribution of risk is not even. And so in the darker purple, the countries represented in the darker purple color, there's much higher risk of climate change and the impact it may be having on children. Unfortunately, it's many of the other countries that are causing the high levels of carbon emission, which is now affecting children particularly in the global South. This is the report from the Born into the Climate Crisis, where Save the Children makes that exact point. The children of low and middle income countries will be burdened with the most dangerous impacts of the climate crisis. And we all have to be concerned with that no matter where we live. This is from the same report that a child born in 2020 faced more extreme weather than their grandparents born in 1960. Twice as many wildfires almost 3 times as much exposure to crop failure, which we know is affecting nutrition, more than 2.5 times the amount of drought, the amount of flooding in rivers, and almost 7 times as many heat waves as past generations. These are going to have a profound effect on the developing child, whether it's air quality. And we know that young children breathe in faster and bigger quantities of air. They're lower to the ground where pollution levels are often higher. So these things have a detrimental effect on their everyday life around the world. We know that it's impacting water scarcity and the quality of the water, which leads to diseases which we know children die of in the early years of their life. Heat waves and extreme weather events are having an impact on a daily basis for children around the world, and certainly food security and nutrition, migration, and poverty. It's been estimated that about 88% of the global burden of disease attributed to climate change is borne by children under the age of 5, and even higher than this in some communities. Globally, 93% of the children live in environments with air pollution above what WHO recommends as optimal. A sudden decrease in food production and access to food, compounded by decreased diet diversity, have increased malnutrition in many communities, especially in low-income households with children and pregnant women, where it couldn't be worse, right? The quality and availability of water impacts child development and is, of course, affected by drought, floods, sanitation, and chemicals. And I want to reinforce that it's not just weather, that there are other contaminants that communities all around the world, and some of the poorest communities, are dealing with, such as chemicals, sewage, and urban runoff, accumulation of plastics, and indoor air pollution. So we have to be concerned with all of this. On the good news side, we are seeing more and more organizations, including UN agencies, stepping up and talking about what we can do about this. UNESCO, on the education side, UNESCO has launched the Greening Education Partnership, where they're really focused on encouraging learners that are climate sensitive. The Global Partnership for Education has developed a climate smart education framework. It'll be important for us to know about these initiatives and make sure they focus on the early years of life, as well as children move up higher into the grades. What you're seeing on the screen now is from WHO. They've developed health and environment scorecards for 60 countries around the world. So these are important resources for us to understand, to know about, and to put to use if they're available in our countries. So we see, and I think this is our next main message, and the message that we want to bring around the world, that early childhood can be a core protective factor. We can build stronger and environmentally friendly early childhood services. We can bring children closer to nature. We can support families as they deal with the changing environment, including encouraging more green jobs. We can help communities prepare for and respond to disasters. Early childhood providers have always been in the forefront of first responders when it comes to disasters. We have to partner with youth and parent groups that are concerned about the environment, speak out for environmental justice, and certainly in the case of the group here, support research that documents these impacts and puts the research to work for change. I've been especially excited about the youth advocates that are growing around the world. Here's some of the names of the groups that are global groups of youth advocates. I'm sure they're emerging in your region too. We have to partner with them. We have to talk to them about young children and how they can help us be the voice for young children. There's also parent advocacy groups emerging, and I think it's parents who are the most concerned about the well-being of their children through these environmental changes that we're seeing. On the horizon, I just want to make sure we all know that there is a general comment on children's rights and the environment with a special focus on climate change that's emerging. It'll be general comment number 26. When that comes out, I think it'll be really important for us to look at it, to do research around it, and to make sure our policymakers know about it. And then, of course, COP28, which is the global meeting on climate change, will be in the UAE, November 30th through December 12th. And there's many people working on making sure that there's a children's climate action plan that comes out of that, and a focus on education. And I hope all of you will be involved. Certainly, your research that you may do around climate will be particularly timely. So what are the implications of all of that for research? What are the specific environmental risks facing children in your country? It'll be very important to document those country by country. And how can early childhood programs best serve as protective factors in the communities that you live in where children are cared for? So those are two of the many questions that come out of the risks and the protective factors that children are facing. Let me move on to two trends that I see emerging. And they're related to all of these risks because I think they both have potential to improve services for young children. First of all, we're seeing an increased focus on caregiving and the caregiving economy. And second, we're seeing a much more systemic approach to early childhood that brings the sectors together and looks at community solutions, not just solutions that emerge at the global level. This is brand new from the American Academy of Pediatrics. It is a new supplement that just came out a few weeks ago that outlines and promotes early childhood development globally through a variety of caregiving interventions, including the famous Jamaican study and the package of interventions that came out of that study and have emerged over the years. So this is exciting that we're finally seeing a focus on the importance of responsive caregiving and how we can support it. I want to make sure that we always include men. This is from Equimundo that has helped launch the Men Care campaign. And I know Dr. Gassan in the region has been very focused on making sure that men are always involved in the discussions. They're important for children. And we have to make sure we're talking about caregivers and including that father perspective, that male perspective in the picture. Parent involvement is not just mother involvement, it's the whole family. Childcare at the same time has emerged as a core issue. And I mean here, childcare mostly while women are working. These are two pictures that depict that. There have been a number of reports that have been released over the last 3 years by ILO, by many organizations. Probably the one that you may have read and thought a lot more about is Better Jobs and Brighter Futures, investing in childcare to build human capital, which was released by the World Bank just a few years ago. Two of the most important facts from that report: it was estimated that 350 million children under school age, under the age of 5, in low and middle income countries need childcare. If we provided that, we could create 43 million childcare jobs. So childcare is a child development issue, it's an early childhood issue, and it's an economic issue, particularly around job creation. And I think that's part of the messages that we have to send. A few years before that report came out, we already were very aware that for the poorest children are at greater risk of being left alone without adequate care while their parents are working and beyond. This just shows you that in the richest countries, and the richest population in those countries, there's a big difference between their availability of adequate care versus the poorest communities. And so this is a concern and one of the driving reasons why we have to support out-of-home care and all the various types of care that parents can access, particularly as women enter the workforce. At the same time, we've been very concerned, and I'm sure you have been too, about the discrepancy in wages. We have childcare providers all over the world that hardly get any wages. This is a chart that shows the average wages of early childhood and pre-primary teachers compared to other teachers who are also usually underpaid, but it's a significant difference. We can't be expected to attract and retain qualified people to have quality programs if we're not paying them adequate wages. And I know that you're concerned about that and that your research has begun to document those concerns. So there's a big childcare agenda emerging about better employment. This is from the World Bank. The Early Childhood Development Network is also encouraging us to have quality, affordable, and accessible childcare. Let me move on to the second trend, and that is moving to a more systemic approach to early childhood. Really, I use this picture of a quilt because I think what communities and countries are trying to do is piece together their early childhood subsystems into a more holistic picture. They're moving from a focus on a single program to a focus on a community or a place. And I think there's many ways to depict this. This is a graph that I've used a lot. When you think about an early childhood system, it's often made up of subsystems: health, nutrition, mental health, family support and economic support, early care and education, and then the surrounding community. Is it safe and is it environmentally healthy? All of these parts affect the developing child. So what I've seen communities say is, okay, why don't we set a set of goals for ourselves in this community across that developmental continuum? We want healthy pregnancies and birth. We want children thriving at 3, eager, engaged, and curious at school entry, and successful and well-rounded by 8. That's the early childhood continuum. At the same time, we want to underscore that we want caregiver to also be socially and economically healthy, and that their living conditions are well, because we know that affects their children. We go back to those developmental principles, and we want equity for children, families, and for caregivers. So grounding us in our goals for children and families helps us develop a more systemic approach. At the community level, what we've seen emerging around the world are coordination mechanisms. So something at the community level that can bring those subsystems together. Connections, so that we avoid disruption. So families don't start a service and then drop it because they don't know anything else about how to navigate the rest of the early childhood system. It's our responsibility to provide those connections so that we avoid those disruptions in the continuum. We want to be more holistic in the way we're communicating our messages. We now have a lot of parenting programs around in the same community. They may have different messages. How much better would it be if we had surround sound? We could intensify our impact if we had more coordinated messages. And of course, all of this is critically important to have parents and providers informing the processes at the community level, informing us about what they need, helping us with data collection. Of course, that's also a key research need. And of course, it needs financing to make it all happen. Another way to say the same thing is, I put it in a chart to underscore those core pieces of the infrastructure that's needed to develop a holistic system. This is one of my favorite pictures, so I always bring it with me. Because it shows what a community can do. This is a laundromat where people come to wash their clothes because they don't have a washing machine at home. And they took this laundromat and made sure there was a library in it. What's the messages that community is saying? It's saying children are Families are important. You don't learn over there in a box, you learn everywhere, and we want to be supportive of you. So what are the implications of these two emerging trends in the field? What services and supports have shown to be the most effective in supporting caregivers in your countries? Is there research mapping the early childhood system in your country? What else is needed? And I want to make a special plea to make sure that we're thinking about and addressing the system needs for children with special needs and ways that we can support their families. And what community solutions have emerged, and how are researchers involved in supporting and in documenting those local solutions? So many good solutions come from communities at the local level, but we haven't documented them. We document these larger global efforts going to scale. It's time to look at innovation in our home, at home. So let me move to the last section, which is innovation. And I really have said this to Grace and to Dr. Gassan. I think that the strategic research model that is emerging in the region is an innovation. And I'm really anxious to talk to people, have you talk to people around the world about it. What I see happening in research is much more focus on implementation science and rapid cycle research. This is a report that came out of the New York Academy of Sciences a few years ago, focusing on implementation research. In other words, what makes the difference? Not was there a difference, but what are the elements in a program of services that is making a difference to child outcomes? And how do we do this in a much more rapid way? And I'll show you an example of that. We have new measures emerging. This is the cover of the technical report for the global scale for early childhood development, which is a population measure for children under 3 that is being developed by WHO. I'm sure some of you have heard of that or been involved in that. That's an exciting new piece of measurement that's emerging. I know that there's many regionally specific measures also emerging. And so these are all innovations. We've got an increased use of technology for data collection. And I think that COVID has actually accelerated our progress on that. And then finally, we've got much more focus on research from the global south, which I think is going to help us in innovating our programming. So this is the Moving Minds Alliance. I just wanted to mention the Moving Minds Alliance has a research forum. I've been very honored to co-chair that with a colleague from BRAC in Bangladesh. And the research forum, I hope you're getting the roundups. We're putting out roundup of research every month. We've been doing webinars. Dr. Gassan and Grace just did one for us a few weeks ago. And we're excited that we have a home for research for young children and emergencies, which needs so much more attention. Three of the principles that came out of that research was to center the voices from people involved in humanitarian crisis directly, to engage and empower more local researchers, and to reconceptualize implementation and research in emergency settings, because it's so hard to do research in emergency settings. And I think it's time that the scientific community acknowledge that. There was a whole host of recommendations that followed those principles that really talked about having a more nuanced understanding of crisis, more focus on cross-sectoral research, understanding the caregiver needs about their well-being, including the frontline workers, understanding this crisis cycle that I talked about earlier, and then having better data. We shouldn't be estimating how many young children are facing emergencies. We should have that data. We should have it country by country. I want to just mention that we just announced 5 fellows. We are now doing research fellowships. There are only 5 to start with. I hope we can grow it. They were people that were born or live in a country affected by crisis or conflict with deep connections with communities were eligible. We've got over 100 applications. We could only fund 5. Applications were accepted in English, French, Spanish, and Arabic, and we're very excited. We think we have to build the capacity of young researchers, and there's so much more that we can do. Let me turn to one example of rapid cycle research, and this is work that I've been involved in. This is work that is being implemented by a new center on early childhood at Stanford University, started at the University of Oregon and recently moved. We've been doing an ongoing survey of households with at least one child under 5 since the beginning of the pandemic. We were doing weekly surveys. We then moved to twice a month. And now we're doing them monthly. It's a mixed method study, qualitative and quantitative open-ended questions. We look at 5 areas: adult emotional well-being, child emotional well-being, material hardship, childcare, and pediatric healthcare. And this is all done with a smartphone I could go on to all the details, but I just want to tell you in essence 2 things. One, overall, what we found won't surprise you. I think if you've done any research during COVID, and even now, what we see is that financial hardship was associated with caregiver stress, which then in turn was associated with child distress. It was the chain of hardship that we have to keep documenting to show policymakers why we need to be supportive of the financial and material needs of parents, because that affects their stress and therefore affects child development. So the other thing I wanted to tell you about this study is that we've been starting to document the everyday concerns that parents have about the environment. And I sent ahead the 12 questions from the rapid survey that we've used to ask parents about their concerns about the environment. I hope that they give those out to you, and please feel free to use them, to adapt them, to at least think about them as you develop your own set of questions. Here's what we found. We found that a high percentage of families, and this is in the US, have experienced at least one extreme weather. And it was all across the board, from the Midwest to the West. So through this simple survey, we're documenting, had the families experienced extreme weather, which is a question that you can ask. We also asked, were they concerned about not just the climate, but the overall environment around their homes? And by and large, we saw across income groups, higher for lower income families, that they are concerned about the impact. Parents are concerned about the impact of changing climate and environmental degradation on their children across the income group. That's where we should start our advocacy, with their concerns and ways that we can help them with their stress that they're feeling, and they are feeling stress. We also asked them about taking their children out to nature. This is what we found, the percentage of parents that take their children out. We are going to explore this further because we think there's reasons, and safety reasons in many cases, that parents may not take their children outside, but we need a lot more information about, again, how to help parents as they're living through the changing climate. So what are the implications of the research? What are the implementation issues facing programs, and are they included in the design of the research? That's probably the most important. What are the new measures and methods emerging in the region? And what do parents say about climate change and environmental issues that they are facing? So I'm going to end it there. I hope to come back and talk to you in a Q&A, but I want you to remember that every child in every family can succeed. And I want to thank you from the bottom of my heart for everything you do for young children and families. You give me hope. You give me hope that we indeed can create a better world for children. Thank you very much, and have a great meeting.